How to cure tomato varicose veins. Most of you are already extremely aware of the medicinal characteristics of tomatoes, but not everyone understands that varicose veins may naturally be cured with tomatoes. Tomato has therapeutic capabilities as a result of the fruit's aspirin-like component. This acid is considered a natural blood thinner and anticoagulant. Furthermore, tomatoes have flavoring that strengthen the walls of the blood vessel. The use of green and red mature tomatoes is two outstanding natural medications for varicose veins. Natural therapy of green tomatoes in varicose veins. A fairly easy home cure for the elimination of varicose veins is green tomato. You just have to wash and cut into circular pieces a few green tomatoes, or rings. Then put the green tomato slices on the varicose vein and the capillary vein network. Fix them with a bandage if required. Keep your tomato slices in these places until you feel a tingling feeling on your skin. If you can't endure the feeling, then take away the tomato slices and wash the veins with cold water, as soon as you feel a scorching sensation. If this treatment goes properly, the outcomes will be obvious very shortly. Repeat 5 times a day for best outcomes on an ongoing basis. The venous nodes are beginning to diminish 2 weeks after you have begun this natural therapy. In the end, there will be a swelling and capillary system of the venous discomfort and nodes. 2 home treatment of varicose veins with red, mature tomatoes. The technique with the green tomatoes is almost the same. Wash and cut into thin a few ripe tomatoes. Put slices and place 3 to 4 hours on the sore veins. To correctly fix several bandages. Wait for a while and replace fresh tomatoes. In the evening, the optimal time to execute this surgery will be. The therapy lasts on an individual basis. This home treatment can also be done in combination with green tomatoes. If you like the video, give it a thumbs up and share it with your friends. If you want more recipes and tips, subscribe to the channel.